All right, well, welcome once again, everyone, to the fourth UIC International Student Virtual Town Hall. My name is Anna Hoban, and I'm an Assistant Director in the Office of International Services. To begin today's event, we have Neil McCrillis. He is the Vice Provost for Global Engagement here at UIC.
Thank you, Anna. I appreciate you introducing me, and I want to welcome everybody who's participating, and I also particularly want to extend a very warm thank you to my colleagues in the Office of International Services who have devoted a lot of time to organizing these town halls, this being the fourth of four, and then also to extend a very great thank you to my colleagues in various other offices that are going to be joining us. And I'm glad to be part of this because I'll be learning some things I know that I don't know. And so I hope that all of you will gain from this. I certainly will. And I'm looking forward to hearing questions and hearing the responses and guidance that our colleagues are able to provide. So I look forward to it. Thank you.
Thank you, Dr. McCrillis. Next, we have Jim Hammerschmidt, and he is the Associate Vice Provost for Global Engagement and the Executive Director of the Office of International Services. He's going to, lay the framework of what we're talking about today, which is health issues related to the COVID-19 pandemic.
Thank you, Anna. Just want to ditto what Dr. McCrillis has said. Welcome to all of you, and hopefully these town hall meetings are of value. We think they are. The topic today, as Anna had said, was health matters. So we'll try to address wellness issues, and so we'll have topics related to that: counseling center, mental health, physical health, and then we are also going to talk about campus care and coverage and things like that for not only the summer but into the future. So I appreciate that, and without further ado, I'll turn it back over to you.
Thank you so much, Dr. Hammerschmidt. So quickly, I'm going to introduce today's panel. We are very excited to have David Worster, the Director of Managed Care at the University of Illinois Hospital. And then we also have his colleague, Jennifer Thornsbury, and she's an Assistant Director in Campus Care. They're going to be answering all of our questions that we have about the Campus Care program. We also have Annette Wright, who is our Associate Dean of Students in the Office of the Dean of Students. We have Mirka Ivanovich, and she is the Assistant Director for Training and a Staff Psychologist in the Counseling Center. She's going to be addressing some of our questions about mental health as it's related to COVID-19. And then we have Carol Peterson, who is our Associate Director in the Wellness Center, talking about other support services, including the pop-up pantry that we have here for students at UIC. So, and then we also have Megan Ward, our Director of International Student Outreach and Services in OIS. Megan's going to be handling any immigration-related questions that come up in today's panel. And then lastly, my colleague, Steven Stahl, he's an Assistant Director in OIS. He's going to be handling all of your Q&As. So great panel today. Without further ado, let's jump into the questions. So the first one, I'm going to direct to David and Jennifer about campus care. So what should international students know about campus care and how it covers medical care related to COVID-19? Is testing covered? Is antibody testing covered? And what about treatments or hospital stays related to COVID-19?
This question has a couple different parts. So just to start, in response to the pandemic, Campus Care implemented some policies and changes to our benefit structure that currently will run through. They were approved by our Oversight Committee through May 31st, 2020. The committee is meeting tomorrow and will most likely extend those changes to our policy to address the pandemic. And right now, it looks like we're proposing an extension, at least for now, through August 15th, which is the end of the summer term. We will be posting those updates on our website. So if anybody doesn't have access to our website, it's campuscare.uic.edu. There is a COVID-19 tab, which you can receive and has all of the information regarding the changes to our benefit structure to address the COVID-19. So right now, all testing and COVID-19 related services are covered. So it's important to keep in mind that Campus Care, the structure of Campus Care, which is a closed network model and requires authorization from a primary care physician prior to seeking care, specialty care, ancillary level care, is still in place. We are asking that students still reach out to their primary care physician prior to seeking care outside of the university, because our family medicine, Department of Family Medicine, which houses the primary care office for our students, does have telehealth and e-visit capability. And if your issues can be addressed via telehealth or e-visit, we would certainly request, it's certainly the best course of treatment as opposed to you going out into a healthcare setting or a hospital or an ER where you could potentially come in contact with the virus. So we ask that you reach out to the primary care office first to see if you can be treated via a telehealth visit. Now, if you can't, the changes that we've made to our policy would allow for any telehealth, all telehealth and e-visit, whether it's COVID-19 related or not, are covered, would be covered under Campus Care, and they are covered with no co-payment or cost share to the members. So those services are covered at 100%. Testing is also covered at 100% with no copay to the member. If a member requires an inpatient stay out of network, outside the UI Health system or outside our Rockford or Peoria system, those would also be covered at 100%, and they would have an in-network copayment assigned to them. So right now for out-of-network services, for Campus Care, any out-of-network services need to be medically authorized by Campus Care, which is still the case. So, which is why we're reinforcing the fact that we want students to reach out to family medicine. If you are not on campus, if you are out of the state, and you don't have access to healthcare, reach out to family medicine, schedule an e-visit, schedule a telehealth visit. They can secure an approval for you to seek care outside of the network. And with an approval from family medicine, that care would be processed at in-network levels, meaning it would be a $15 copay for an in-network visit. If you needed to seek care at an emergency room, the 30% coinsurance that's typically applied to an out-of-network emergency room visit has been waived during this period. So the 30% coinsurance for out-of-network emergency room is not applicable. So those are also processed, will also be processed at in-network levels. So I think that answers entirely. I know I put a lot more information into that, but I think that answers the question regarding hospital stays and COVID-19 testing. All of those, provided they're medically necessary, are covered. And COVID-19 related services and testing, COVID-19 related testing is covered with no cost share.
Yeah, that does have a lot of great information. I think the things I take from it are, any student covered under care really shouldn't be worried about, contacting University Health Family Medicine to try and get some help. Those telehealth visits you said are available without copay. Even if they're outside of Chicago, contacting University Family Medicine and getting connected there is going to be the way to go. So,
correct.
Yeah, I think that's good. The next question goes a little bit, you talked a bit about in-network versus out-of-network. And I think that concept is often confusing or just unfamiliar to international students who haven't grown up in an insurance-heavy context the way we have.
Sure.
So can you just, for those that need it, can you describe what is the difference between in-network providers and out-of-network providers, and why is that important to understand when it comes to health insurance? And will campus care cover a student's medical expenses if they become sick with COVID-19 outside Chicago? I think you already talked about this a little bit, but a second time could be helpful.
Sure, we can reinforce it further. Absolutely. So, under normal circumstances, campus care would cover out-of-network emergency room, as I indicated before, the 30% coinsurance with $50 copay. Due to the pandemic, the out-of-network emergency room care would be covered at an in-network rate. So we're waiving that 30% coinsurance, which is pretty substantial. With respect to out-of-network care, non-emergency out-of-network care, we still would require that those services be authorized by campus care. So in order to secure an authorization for out-of-network care, you do need to contact the Department of Family Medicine and schedule an appointment. It doesn't need to be in clinic. It can be via telehealth or an e-visit, but you still would need to secure an authorization to receive that care. Now, the fact that under normal circumstances, if that care could be provided in network, we wouldn't approve it. It wouldn't be authorized. We would actually require that to be redirected in network. But under the current circumstances, provided that an authorization is received from family medicine and family medicine is fully aware that our student population has been dispersed, those services would be provided at in-network level. So if you if you needed to seek care out of network, if you're in Wisconsin or Ohio or outside of the Chicagoland area, and it was approved by campus care, the care would be provided at in-network levels or would only require a $15 copayment. And did I catch all that?
That sounds like a really...
There was one other part of that question as well. So yes, regarding the COVID-19, absolutely. Any medical expenses related to becoming sick from COVID-19 outside of Chicago are going to be covered.
I just want to can I add something, Anna? Sorry.
Absolutely, Jennifer.
I just want to be very clear, just because of the population we're speaking to in this town hall. We are discussing services only within the United States. So anybody who is out of the country, these new policies do not apply for. Campus care still does not cover. We don't have the ability to process any type of claims or services that are rendered outside of the United States.
Thank you so much. I think that's a really important distinction. So yeah, if somebody, ended up going to Wisconsin or Michigan to stay with family during this crisis and needs to seek care for COVID-19, campus care would be able to help with that. But if you went back to India or Europe, someplace outside the United States, it no longer applies, right? So thank you for that. The next question was probably our most received question throughout the registration form, and it's about summer billing. So some international students will unexpectedly remain in the U.S. this summer due to international travel restrictions. Others have lost summer jobs and the associated income. Has there been any discussion of waiving or discounting the summer campus care fee for students who need the coverage but can't pay or have trouble paying?
Well, this has been brought up by several different student populations. And I mean, these are obviously extraordinary times that we're all dealing with. And the university has been strained significantly in a financial means due to this COVID-19. So with respect, I can speak relative to campus care, and with respect to campus care, we've tried to make it as easy and as financially viable for the member as we possibly could by waiving those out-of-network cost shares, by waiving cost shares for COVID-19 testing, by approving care out-of-network. When it comes to discounting the actual premium, that's kind of outside of our purview. And a decision to waive that subsidy or waive and or subsidize the student premium really needs to be made at a senior level within the university. I know there have been discussions, but I don't know if any decisions have been made regarding the ability to subsidize the summer premium. Unfortunately, that's all we can really provide today.
Well, thank you. I appreciate you sharing what you can about the conversation, and hopefully this can be a forum to continue to bring the concern to the table, and it can be considered at the levels that it needs to be. So I appreciate you addressing that question. It looks like there was, Jennifer.
Sorry, can I just add one more thing to that? I just want to remind everybody
Absolutely.
too, if students are registered for classes, the campus care fee can be covered by the financial aid or paid for by financial aid as well. So financial aid would cover tuition and all fees, and that covers the campus care fee as well, which I know eventually they'd have to pay that back. However, at this very moment when they don't have a job, that is another option.
Yeah. That said, the federal financial aid is not typically available to international students. So that's sometimes where the challenge comes up, because they're not eligible for that type of federal funding. Yeah. There was another question that came up related to the telehealth visits. Jennifer, do you think you could clarify if telehealth is provided for those who are outside of the country? Say I went to my home country for the summer, but I'd like a telehealth visit with family medicine here in Chicago.
If they're calling our family medicine center, the telehealth visit would still be covered, even if the student is out of the country. Any further services that are recommended, however, that the student goes and receives, even off of the basis of family medicine, one of the family medicine physicians, if it's a service that's actually provided outside of the country, that's what we do not cover. So if they called family medicine, they'd be covered. If they were referred to a specialist for a telehealth visit as well, it would have to be at UIC. It would also be covered. But if they receive any services outside of the country, it's not covered.
Thank you for that clarification. The next question, still on campus care, is looking at students who are doing summer online courses but from abroad. So will international students enrolled for summer classes but taking them from outside the U.S. still be charged the summer fee for campus care?
Do you want me to take it?
So what we've done is we've met, the university as a whole met, and this includes individuals in the Office of Business and Financial Services as well. And from an administrative perspective, the easiest way to administer this is to charge, since everything is migrating to online only, is to charge students with campus care. However, so all online students will be charged with campus care, but if you are out of the country, you can waive campus care coverage. And you have an opportunity to waive the coverage, but you are required to go into the campus care website and waive coverage if you are charged with it. Now, if a student already has a waiver on file for this academic year, that waiver would be applied. So all students would be charged with it, but on the back end, we would review if any students currently have a waiver on file, we would remove the campus care charge. But if they had campus care, now they're out of the country, and in the summer they're charged with it, they will have to submit a waiver for that coverage. but the waiver would be, accepted. It's because campus care obviously doesn't apply to students receiving care outside of the United States. So we would process the waiver. But unfortunately, that was the only way that we could administer it to ensure that all of the students that are online and require insurance coverage during the summer, particularly due to the pandemic, are receiving that coverage. So we erred to the side of caution to make sure that everyone that needed coverage has it, and if somebody doesn't need the coverage, they have the opportunity to waive it.
Yeah, with all of these big changes, we've been given some good opportunities to provide services in different ways for telehealth or e-visits, but it's also been very challenging too, figuring out how this all works with people spread across the globe now. I was just one question about the summer waiver forms. Are you able to give any details on what type of documentation or information a student might need to submit to prove that they're outside of the country?
Jennifer, you want to address that?
Sure. Yeah, the waiver form requires the name of the insurance company, normally a contact phone number, and a member ID or group number. If they don't have a group number, wherever they are, they can just put, NA or 0 in that box. But some sort of form of identification to specify what they're covered under. So their member ID would be particular to them, specifically under whichever insurance company.
Okay, so they would need to show that they're insured, otherwise insured, during that time period.
Yeah, and their phone.
And if they're out of the country, they could provide us with a travel itinerary that shows that that they traveled outside of the country and they're no longer within the United States, and provided that they're residing currently outside of the United States, we would accept that as well.
Okay.
If there are any students who don't have all of the information that is required to be provided into a waiver, if you can just email Campus Care, we'll work with you to request the proper information to get you waived out. Mm-hmm. We'll submit the waiver for you.
Okay, great. That's good to hear. You'll work with the students to figure it out. Great. Our next question is about emergency funding. So, as we talked about, the fees for the summer insurance will be there, but we're wondering what resources exist for international students who are experiencing financial issues as a result of the COVID-19 pandemic. And Annette, we're hoping, are you there?
I am. Can you hear me?
Yes,
okay,
yes, Annette.
Good.
Annette, right from the Dean of Students is going to address that question.
So good afternoon, everyone. And so, yes, there are currently two sources of funding that international students are able to take advantage of. The first is the Uni Care Grant, which is distributed through the Office of the Dean of Students. It's an online application. It's pretty simple to complete. Literally, we're just asking students to explain what occurred, how would they use the funding, along with, which I think is most important, providing documentation. The only caveat that I will also add about the fund is that students must be registered in the term for which they apply, and the maximum amount that students were able to award at this point in time is $500. The second source of funding is for graduate students. The Graduate College is now distributing an emergency fund, and very much similar to the Uni Care Grant through the Office of the Dean of Students. Same requirements. Students must be registered in the term for which they are applying for the grant, as well as providing supporting documentation. These grants are both distributed on a first-come, first-served basis. And one other important thing to note is that students at this point are only allowed to apply for or receive, let me back up, they're only allowed to receive one emergency grant. So students can't apply for both. As with the Uni Care Grant, I believe the graduate college grant is also distributed on a first come, first served basis. And so definitely encourage students who need assistance to reach out. If they have questions regarding either application, to reach out to those offices. Both the Uni Care Grant application can be found on the Dean of Students website. You can log on to our website and look for the Uni Care Emergency Grant. And the information for the Graduate College Grant is also located on their homepage as well.
Great. Thank you so much for that information. Hopefully students have already started taking a look at those grants or will after today's session.
Absolutely. Well, I can say that we have received a number of applications from international students, and we have been awarding them. So typically it's anywhere 40 hours, 2 or 3 business days turnaround time. So we are trying to be expedient when we process these grants.
Yeah, that's great. As they are emergency grants, so people who are experiencing emergencies can get some much needed help if possible. My next question is about receiving medical care. So, we've kind of talked about this a bit, but it can bear repeating. What should an international student do if they feel sick and need to see a doctor? Are telehealth visits available? We said yes. And will UI Family Medicine be open during the summer? This question was brought up a couple times about does UI Family Medicine close?
No, the clinic is open, but they are also providing, as we indicated, telehealth and e-visits, but the clinic is also open. I think that the preferred method of care at this point would be a telehealth or e-visit, but certainly if a member needed to be seen in office, the clinic is available as well.
Right. And it's something, again, international students who aren't as familiar with insurance and how that works, should a student call campus care to schedule their appointment with a doctor, or should they call somewhere else?
They should contact Family Medicine directly, the Department of Family Medicine. Their appointment, their scheduling number, they should contact them directly.
Great, thank you. All right, so now we're going to shift just a little bit and talk about mental health. We have Mirka here from the Counseling Center, and I'm wondering if you could talk a bit about what should international students know about mental health as it relates to COVID-19 or the effects of living through a pandemic.
The invitation to participate. Can you hear me? Yes, okay, great. So yeah, we've at the Counseling Center, we've been talking a lot to the staff about just how difficult these times are for many of us. So in a lot of ways, we're kind of like learning as we're going in terms of how people are responding, what they're needing. But we're here for you. We're fully operational virtually and are connecting with students in lots of different ways. And I'll make sure to speak to that a little bit later. But in terms of kind of what we're seeing, it's a wide range of how people respond to this pandemic. But we see, and we were talking a lot about grief as being kind of like a dominant reaction that people are having. And maybe people don't think about grief as broadly as we are. They might think about grief as related to like the death of a person. But we're thinking broadly here that there's so many losses people are experiencing, whether it's, an internship. I was looking forward to a loss of a milestone like a graduation, the loss of whatever summer plans that students may have had, which may have included going back home to their families. And a lot of international students really sacrifice a lot when they come here to study, and they really kind of don't have that kind of physical connection. So that now that's even prolonged, right? So what can look like increased anxiety or sleeplessness or restlessness, irritability can often have like this underlying theme of like grief and loss. So for students who resonate with that, we just want to say that that's a normal reaction to like a very abnormal set of circumstances. We find that like the more we can talk about it, give it some room to kind of be acknowledged, it becomes a little bit easier to kind of carry and bear. And we think a lot about, especially for international students, like the impact of, social isolation and distancing. Some of our domestic students may, have the opportunity to go home to like their families in the suburbs. It's not a privilege that a lot of our international students may have. And so for those of you that are still here, maybe you're either on campus or like in an apartment near campus, we recognize like how challenging it is to be in a pandemic in a country that may not fully feel yours, and how you might be missing out on that connection. So we're certainly encouraging you all to kind of take advantage of the means that we do have with all the kind of social media and technology we have to connect with others, but to do it intentionally, because when we are so connected, I think in a way it could both help kind of overcome some of the social isolation, but it can also add to sometimes like some distress too, because depending on what we see or are exposed to on social media, what we hear from friends or family back home can also like ratchet up some of our sense of distress. So it's really important to be intentional about when do I have the energy to engage in this way? Who do I need to engage with? Who might I need to kind of like be in the right mindset with to be able to talk to in that way? So encourage connection, but being mindful in what way that looks like. And then I think another piece too that we're talking a lot about, that we're naming for some of our students, some of our international students, but also some of our domestic students too, which is, this pandemic has brought out the best in people, but it's certainly also brought out some really unfortunate behaviors, including, xenophobia and like acts of aggression towards folks, especially some of our folks who are immigrants or who appear to be from certain parts of the country, like some of our Asian students. And so we're very much recognize that that's an additional stressor for some of our students, and we're doing what we can to both bring awareness to that. Like we've been putting out weekly like newsletters and then resources where we try to kind of speak to this and speak to ways that both we can be allies to students who might be targets of that, and how we can kind of speak up, while also recognizing that adds potentially an additional burden and source of stress for students who are the targets of that. So we're thinking of you in that way as well.
Yeah, thank you so much. So many good things to consider there. I think your point about what you brought up at the beginning about grief, that is so helpful when we really acknowledge and consider the losses that we've all been going through and how that might be experienced. And also the piece about discrimination or bias incidents that some of our international students, like you said, you might not, be from an Asian country, but there could be a perception there that you are. And I think that's very, very important for all of us to be talking about. So I appreciate you bringing that up and supporting the community. In terms of receiving mental health care, how can you just maybe talk us through what that looks like? Is the UIC Counseling Center open during the stay-at-home order? You are, but if a student wanted to talk to you or talk to another counselor or psychologist, how do they do that? What does that look like? Do students have to be registered for classes to utilize the counseling center? So I'm thinking about the summer break period. Can you talk to any of those pieces?
Yeah, I'm happy to. I'll run through it, but let me know if I miss anything. Yeah, so we worked really hard in these past weeks to bring as many of our operations like online, and we're really proud of how far we've come. So yes, the counseling center is open. You can literally still call our main number and talk to our receptionist. We all are working from home, so when you call our main line, like you will reach our receptionist who is also in their own home. So we're remaining safe. The quickest and easiest way to reach us is, I guess 2 ways. If a student wants to make like a traditional appointment, would be just to call the front desk. And then from there, it would be very similar to how it's looked before. For those who don't know how it looked before, it would be a student would give us a call and say, hey, I'm interested in learning about what you can offer me, or I think I want to maybe talk to someone. And then they kind of gather some very preliminary information from the students, like name, contact info, and they schedule a conversation with one of our counselors. Students who might have like more urgent needs, they can also kind of identify that on the phone, and we have ways to kind of check in with them on a more urgent basis if that's a need. But usually we kind of operate best from kind of like scheduled appointments, and it's a very short turnaround to kind of get an appointment with someone right now. So if a student wants to call today to schedule what we call an initial consultation, they could be seen, as soon as tomorrow, potentially, or the beginning of next week. And in those initial consultations, which is like the first contact we usually have with a student, both when we were doing this in person and virtually, we really review a lot of the students' concerns. We kind of do a pretty thorough history of like, okay, what's been going on? How long has it been going on? Anything else that could be factoring in? And then from that conversation, we make some recommendations for next steps. And that could include then connecting students formally to our individual counseling services, our group counseling, our psychiatrist, or any host of other resources on campus, some of which are represented here today. So we have that initial meeting, and then we kind of like branch out to resources as to best meet the students' needs. We are holding all of our sessions usually over like video using either WebEx or Zoom. Students who maybe aren't like in a private place or don't feel like they have the capacity to do like a video session, we can hold those over the phone as well. But we do encourage video just because already so much is lost when we're not face-to-face. So we want to kind of approximate it as best as we can and hold those things over video. We have really ramped up our outreach and workshops since we've gone virtual. And you can find a lot of this information on our website. So gosh, like every week since we went virtual, we've been doing workshops on everything from managing your mood during a pandemic, which is a wonderful like 3-part workshop that just gives you lots of pragmatic like strategies to kind of cope. We are going to be running a few more sessions of that this summer. So if that sounds like something that's interesting, again, check out our website, and instructions for how to sign up are on there. We've been doing, just like workshops on like grief and, kind of transitions, and are actively like brainstorming as a staff for what are other areas of need that students may benefit from, and how to like bring that maybe to like a YouTube video that we post and things like that, because we recognize students might not be in a place where they can kind of have regular counseling sessions with us if they don't have the privacy. So lots and lots of really good online content that you can access to our website. I really encourage students to check that out. Students eligible for services do have to be enrolled, but they don't have to be taking summer classes. So as long as like there's, like you've got like your enrollment for fall or kind of are set to come back in fall. We do see students through the summer, and we will not be closing over the summer. So everything that we do during fall and winter, we'll still be doing in the summer. Because of our licenses as mental health professionals kind of have like certain parameters for what's our scope of practice. What that does mean is that we can see students even who are not taking summer classes, but they do have to be in the state of Illinois. So we're not even able to really provide counseling to like students outside of Illinois, really, which is like a restriction for our licensure. So now if a student called us from, I don't know, like New York State, and they're like, I really need you to help me connect to resources, like we're not going to turn them away, but we're just saying we can't offer like ongoing counseling, but we can absolutely, help a student kind of make some headway on finding resources in their home country. There's been, not too long ago, one of my colleagues was put in touch with someone who was doing like a study abroad in like a country in Africa. We couldn't see them for counseling, but like we did some digging around and basically helped them find a counseling center there. So we're absolutely available to consult in that way, even if we're not able to provide ongoing services. Anna, did I cover all parts of that question?
Yeah, it's wonderful. You guys sound very busy, very creative, and how you're helping out students. I really appreciate that piece about, having to be in Illinois. That's interesting, but good to know for our students who might be outside of Chicago. But it sounds like you're still there to help them find the resources that they need where they are. Mm-hmm. yeah, and in terms of how it looks like connecting with your office, it sounds really similar to what we're doing in OIS. So if a student has called OIS to schedule an appointment with one of our advisors, it sounds like a similar experience. So so that should feel familiar to anyone who wants to connect with the counseling center. So yeah, well, thank you so very much. We're going to jump to our last question here, which is about additional wellness support at UIC. And we have Carol Peterson from the Wellness Center. Carol, would you be available to talk about other resources at UIC that support student wellness? And such topics, people had questions about topics like sexual health and also food insecurity. I am going to unmute you, Carol. There.
Can you hear me okay?
I can hear you now, yes. Go ahead.
Okay, great. Number one, thank you guys for asking those questions and for inviting me in. Let me first talk about food insecurity. So I'm the director of the Wellness Center, and it was in about 2014 that I co-founded the UIC Pop-Up Pantry. And the reason I did that was because in 2014 at that time we were seeing that food insecurity among students was pretty significant. And so now, years later, with the pandemic, we recognize that food insecurity among students has become even more of a crisis level, specifically among students who are international. And my concern really goes out for you because you're challenged. You're meeting the challenge, but you're very challenged. I recognize that there's issues of unemployment, issues of underemployment, and then all the other challenges that are coming to you. So let me just talk about the pantry and how it is here to support you. So we're open. We're going to continue to be open throughout the summer. We're open next week. Right now, our current hours are every Tuesday, every Wednesday, from 2 o'clock to 4 o'clock, and that's going to get us through next week. Once we're past with next week, we're going to still be open. We're going to be open every Wednesday. Every Wednesday from 12 o'clock to 4 o'clock, we're going to be open. And so that information is going to be put on our website in case you forget. So recognizing that there is a lot of challenges regarding, just the current state of what's happening in the world and the United States, I want you to know that the pantry's got your back in the sense that we've waived a lot of things that normally you would have had to have done. You don't have to do anymore. We've waived registration for right now. So normally students would have to walk in and register. We've taken that away because it's also just not only just a courtesy just to what's going on in the world, but also just a way to help to prevent cross-contamination. So we're keeping that in mind, your health, your physical safety, your health safety. We've also waived the fact that normally we would have students shop every 2 weeks or every other week, so just about twice a month. We've also waived that, recognizing, like I said, that we have some students who are under unemployed right now with zero income coming in. So having said that, if you need to shop the pantry every week, you absolutely can. At the pantry, for those of you who've never shopped, we have fruits, we have vegetables, we have dairy, we have eggs, we have milk. The items that we get are donated by UIC students, staff, and faculty. We also have a partnership with the Greater Chicago Food Depository, so that allows us to have a lot of food on hand. In fact, our partnership with the depository, we get from them about 30,000 pounds of food a year. So wonderful partner, and because of them, we're able to give you what you need at this time. So I want to make sure that you understand that if you want to shop the pantry, if you need to shop the pantry, that you can do so. We're here for you all summer. And again, look at our website for hours and times. So we're also here for you virtually. So we do individual wellness consultation. So I applaud the Counseling Center. They are doing a fantastic job. Counseling Center, what I would say is that they do the heavy lifting of emotional health, and what we do is we do wellness sessions. So if you have transitional issues, stress management, healthy relationship concerns, wanting to talk to somebody about what the situation feels like in like a one-time session where you get practical advice and ideas, we are that perfect center to reach out to. So we're Zooming, we're doing WebEx, we can do it by phone, whatever feels comfortable for you. We also have an advice column that you can reach out to. We have a listserv. I encourage you to go to our website. We have a lot of information on our website that talks about meditation, that talks about, that provides musical playlists for you. These musical playlists help to lower your heart rate. We've got music that associates and helps you to study and focus, or just to help you calm down in general. So lots of resources are available for you as well. I also want to just quickly touch on just a couple of wellness practices that are easy to do that I want you to focus on. So right now, there's a lot going on. I want you to encourage you to just simply step outside, step out your door, and take in the sun when the sun is shining. Just take in that sun. Here's a couple of reasons why. When you're super stressed out like we are, your cortisol levels are high. When you have high cortisol levels, that negatively affects your immune system. Right now we need to have a strong immune system. So it's negatively affected if you have high cortisol levels. Step outside, take a walk. Walking, any form of exercise, meditation even, helps to lower cortisol levels. 2, stepping outside, looking into that sun, increases your serotonin levels. That helps to increase your happy state, your happy mood. So make sure that you're getting some sun just to help and to do that. Also exercise, just to the best of your ability. I'm not saying do a marathon. I'm just making the point to just get outside and walk around the block. Even doing that helps to increase our endorphin levels, which also is a happy neurotransmitter. So movement and sunshine are wonderful, easy, practical things that you can do to help manage stress and also to improve mood. So, Anna, what was the question about sexual health? Did you say sexual health?
Yeah, I did. Just one student had a question about how UIC addresses sexual health. And I know your office does do some programming around that.
So that's a great question, and so sexual health is it's a great question, but it's also a really big question. There's a lot of things packed into sexual health. It could be healthy relationships. It could be something as practical as condoms. So let me look at those two for right now. If you're talking about sexual health in terms of healthy relationships, definitely reach out to us. We can do a Zoom conversation. We can do a phone conversation. We talk about healthy relationships with folks. Again, nothing to the level of the counseling center, but certainly definitely concrete things that we could talk about. Or sexual health, if it's a nuanced area that we're not touching on, definitely reach out to us by email, reach out to me personally by email, and I will help you answer that question. In terms of practical sexual health, let's say condoms, we are going to be open. We're actually open now. So if you were on or near campus and you needed condoms, we're open every Tuesday and Wednesday, and after next week it's going to be every Wednesday. So if you still wanted to come to the Wellness Center to pick up condoms, you absolutely could. Starting June 1st, everybody's coming back to campus to some extent and some level. Wellness Center will certainly be there. And if you are looking for something along those lines of condoms, we definitely are going to be there to have that. So again, I know that I'm not really answering this question because it's so broad, but if you reach out via email, phone call, I can make sure that we get an answer to you.
I think you answered the question perfectly. The practical matters and all the more nuanced things. It sounds like the Wellness Center is there to support students. So if you weren't aware of that before, now you know Carol, now you know the Wellness Center and what they can provide to you. Just one last piece about the pop-up pantry, because I do think that's really, really important. Let's say an international student is thinking, maybe I would like to use the pop-up pantry, but I'm not really sure. I just want to learn more. Is it okay for them to just show up when you're open to maybe talk to someone to learn more, to see if it's a service that they would want to take advantage of?
Absolutely. I'm really glad that you brought that up. Absolutely. If you have any questions about the pantry, again, call us, email us, show up. If you show up on the very day that you show up, at this point in time, if you show up next week and you have questions, we can do a walkthrough. We can show you what we have to offer. If you want to shop, you can absolutely do that. We have COVID-19 precautions in place as well, because we want to make sure that you have access to groceries, free groceries, but we also want to make sure that we protect your health. So for those, if you were interested in stopping in and shopping, we're asking students if they can to wear facial masks, whether they're cloth or even a scarf. Any scarf wrapped around your face is acceptable. But yes, please show up, because I don't want, at this point in time, I don't want nothing to stand in the way between you and getting a bag of food.
Awesome. Thank you so much, Charlie. I really appreciate your time. We have a couple minutes left here, but there's one question that just came through that I'm realizing I skipped in our moderated question. So David and Jennifer, if you guys are still there and can wake back up a little bit, I have a question about campus care and coverage for graduating students. So I'm going to go back up. Some international students will graduate in May, but are still looking for their full-time job with benefits. Can students who graduate in May extend their campus care coverage until employer benefits kick in? David or Jennifer, are you
Yes, I'm sorry, I'm muted. Students who have coverage in the spring do have the ability to continue coverage for the summer term. So if a student was covered for the spring semester, they can submit a summer continuation form. If they're graduating, they can submit a summer continuation form, which is available on our website, and apply for extended coverage through August 15th. Because our program follows the academic year, for graduating students, coverage would only be available to them through campus care through the end of this academic year. If they're not taking classes in the fall, which would roll into a new academic year, and they're not taking classes, they would not be eligible to extend their coverage further beyond August 15th. And there's a couple things, additional things regarding some things that were touched on regarding the counseling center. You know, in addition to the great services that our counseling center is offering, you know, campus care has a host of specialty services that are available to students through the Department of Psychiatry, who are also providing telehealth and e-visit services as well. So, you know, we work very, very closely in conjunction with the counseling center, and if students need to be referred to a behavioral health provider within the campus care network, those are available also through telehealth and e-visits as well. And there was one other question that I had for Carol, if she had any information on how to donate to the pantry.
Oh my goodness, great question. Thank you for asking. Yes, so if you visit our website, you will see, if you go to our website under resources, you'll see pop-up pantry, click on that. Under pop-up pantry, scroll down and you will see a donation link. And if you go to that link, it'll take you to UI Foundation, which is the foundation that serves all of our campuses, and you'll be able to make a donation to the pantry through that link. And I really appreciate you asking that question. And I also want to go back to, Anna, one of the questions that you said about having students just show up and look at the pantry. We've got 2 videos online, and they kind of give you a sense of what it feels like and what is there. Right now, under COVID-19, we've moved to a different location. We have different setup, but at least it allows you to get a sense of what you're walking into, because sometimes I think the fear of the unknown is what keeps people away. And like I said, I don't want students to shy away from a great thing and let fear stand in that way. So again, thank you for that, for the donation question. I appreciate that.
Great. We are right up here at 2:30 at the end of our time. We've had a really wonderful and robust conversation. I know we have a couple of questions in the Q&A. One person had a question about, you know, it sounds like a question about what it would take to waive out of campus care, and can they have their own insurance? I popped a link to the Campus Care website in the chat. I would encourage that student to go to the Campus Care website. I know you guys have a lot of information about the waiving process if someone has their own private insurance. So definitely take a look at their website. And we have a couple of questions about the Grad College Emergency Grant. I think, those students, you would need to reach out to the graduate college directly. They have information on their website as well about who qualifies for that emergency grant. And if you want some feedback on your application, I think you would need to reach out to them directly. So definitely go ahead and do that. But with that, unless our panelists have anything, final words they would like to share with the group, I'll just give a moment of silence if anyone wants to jump in before we say goodbye.
Anna, I do have one thing I wanted to say. If there are any who are on optional practical training, the question came through, I see on the Q&A, about periods where you might not have health insurance. Definitely email OIS at ois@uic.edu. We do have a listing of international student and scholar insurance providers, and we would be able to provide that list to you for times where you're no longer on campus care, but you're still in the United States. And we'd be happy to help you with that. So please email us. Thank you.
I just wanted to, oops, sorry, Anna. I just want to follow up really quick with the graduation question. So Campus Care's policy has always included that anybody who has spring coverage is able to continue during the summer without registering for classes. So if some of the students are, even if they're planning on coming back for fall, they're not graduating, if they had coverage in the spring, they are able to continue during the summer without registering for classes. They do need to fill out that summer continuation form. We're asking everybody, whether you are taking classes or not in the summer, if you had it in the spring of this year and you want to continue your coverage, fill out that summer continuation form. A lot of people change their mind and drop their classes, and this way you're confirmed and covered for the summer by filling that out.
Great. Any other panelists wanting to share final words, final tips? All right, well, I've opened up one final poll just to get our attendees' feedback on, was the session helpful? If you wouldn't mind answering that question there very quickly before you go, but I just want to say one last, heartfelt thank you to everybody, all the panelists who have given their time to be with us today and sharing your information and your knowledge with us. So thank you very much for supporting the UIC international student community. Take care, everyone, and we will see you soon.
Thank you.
Thank you.
Thank you. Bye.